like Derek Shepherd in Grey's Anatomy, did that. So I assume that's what neurosurgery is like.
No, it's not really how it is. Hi guys, welcome back to my YouTube channel. Today's video is going to be about my first ever shadowing experience. I am, like I said in my last video, a pre-medical student, and I have to shadow physicians or healthcare practitioners to get sort of like experience in the field. One, just to see if that's the field I want to go into, and two, to understand what the rest of my life is going to be like if I decide like medicine is my thing, it's my jam, like I'm going to do it like forever. So shadowing is something we have to do, and it's something I've always wanted to do. I decided to shadow a neurosurgeon. What is shadowing? Shadowing is part of your application that you need to get into medical school. Most medical schools have some sort of requirement on how many shadowing hours / sometimes they call it clinical experience hours that you need. So for me specifically, I'm trying to aim for like 100+ hours of just pure shadowing. Not like, this is not combining like volunteering and like actual like working as a medical assistant or a scribe or an EMT. I really want to work as an EMT, but research, like those are completely separate things. I honestly don't see it as like a goal. I see it as more of like it's gonna happen, just because I have so many different fields I want to look at. Videos you can look out for, like for right now, is neurosurgery. I want to try out radiology, pediatric neurosurgery, and I'll go into why for pediatric neurosurgery. I also want to look at infectious disease, pathology, and emergency medicine. So there's a lot of different fields that I'm like really interested in. Some are like completely different from the other, which is why I think shadowing is so important, because if you don't know what each field does, and again I'll talk about how like neurosurgery was completely different from what I expected, if you go in with these like notions of,
oh well, like Derek Shepherd in Grey's Anatomy, did that, so I assume that's what neurosurgery is like.
No, it's not really how it is. I think that's why going in person and actually shadowing a doctor is really important. Specifically, what is neurosurgery? Neurosurgery is a branch of medicine, specifically a branch of surgery that involves both the brain, the spinal cord, and all the nerves around, like peripheral nerves in the body. One really big misconception that people have about neurosurgery is that it's just the brain. I mean, that's what you see on like those like really fast-paced TV shows. It's like they're operating on like a brain hemorrhage or like a tumor that's metastasized to the brain, and they're just like trying to take it out. That's not all neurosurgery is, and that's like one of my first things I realized once I started shadowing, was a lot of neurosurgery is actually spine. Obviously there's some surgeons that specialize in like brain tumors, there's some surgeons that specialize in like functional neurosurgery. So back to my initial point, neurosurgery is not just cool brain science stuff, it's also about the spine and the peripheral nervous system. There's two different parts of neurosurgery, and this one I personally did not know. Because again, this is my first ever shadowing experience. I am a freshman in college. Like, I don't even know how I got this like position. I asked the doctor and he said yes, but I genuinely, like, this is a great opportunity that I got at such a like beginning stage of my pre-medical career. So I really didn't know anything about surgery in general. So basically there's two different sections of, I assume like almost every surgical specialty, but with neurosurgery in specific, there's clinic and then there's OR. And this is specifically for private practice, because the surgeon that I shadowed was in a private practice. Clinic is basically where if you need like a spinal checkup, or like you need like something's wrong with their like pituitary gland, or you would go into a clinic for neurosurgery and they would check you out and they would see, and they would tell you, okay, maybe you're not viable for surgery, but there's other options that you could use. However, if they are viable for surgery, then they would sort of get booked into surgery, and then that's how the neurosurgeon gets patients to operate on. For me specifically, I had to go through something called orientation. So orientation is where you'll get in contact with a human resources officer in whatever hospital you're working at, and they will assign you orientation for both the clinic and the OR setting. This includes going over HIPAA, which we'll realize I'm not giving any patient information out. This is all specifically just about my experience and neurosurgery in general. So you'll learn all about HIPAA, you'll learn about like sterile fields and being hygienic, you'll learn about proper PPE, you'll learn about how to be professional and how to dress professionally. And then for OR orientation, you'll learn how to scrub in, even though you probably won't be able to scrub in the actual surgery, because there's a difference between shadowing and scrubbing in. Scrubbing in means that you're going to be in the sterile field around the actual patient that's being operated on. Shadowing could mean that you're standing a little, like you're standing outside the sterile field. So if this is the sterile field, this is where the surgeon is, this is where the first assistant, second assistant would be, and this is the sterile field. I was like standing all the way over there. So like I was like nowhere near the sterile field at all. You have to be very careful when you're actually in the OR, because there's certain like equipment too that's also sterile. So it's not just the sterile field. There's a table where all the equipment is laid out. Can't go near that. Sometimes the x-ray machine is also sterilized, so you cannot go near that. So you have to be very aware of your surroundings when you are in the OR, because it's not just the patient. Like even if you're fully focused on the patient, you have to be aware there might be a scrub nurse behind me that is walking by and she's scrubbed in, so I cannot touch her because I'm not scrubbed in, so like it would be contamination. So I have to be very careful. I have to like move around to make sure like we're not getting into contact. So it's very there's very specific things I have to be aware of when you're scrubbing in, which is why we went through how to scrub in, what causes contamination, what doesn't, how to properly put on gloves. I mean, there's a art to how surgeons put on their gloves, and I always saw it as something like easy, they just like and they're done. No, there isn't. I mean, there's even a certain angle you're supposed to like keep your hands up. Like it can't be down here, it can't be up here, it can't be like there's a certain angle where you have to keep your hands up once you wash your hands. It's crazy. There's so much that goes into keeping the patient safe, which I think is amazing, because I mean, even if you are the patient, you don't even realize how much like your doctor is going or putting into like your safety and your like hygiene, which I think it was really interesting to see. Going into like what I liked versus disliked about my sort of shadowing experience. I really like the brain. I'm a neuroscience major, so obviously like that's something I'm really into. Like it was like solving a puzzle. Like he would see this image of like a CT scan, MRI, X-ray, and he would use all these different like angles. He would piece them together and sort of like see and zoom in and zoom out to see exactly and like pinpoint where the problem is. I found that really interesting. I found that like sort of like solving a puzzle, or like this find the difference games. Like that's kind of what it was like. It was to see like between a healthy brain and an unhealthy brain, what exactly was wrong with the person that came in with like they were fatigued or they had pain in their like wrist, or like what was the problem. He sort of understood like so many different things all at once. Like if a person came in with like lumbar pain, he would automatically ask, well, did you have pain in your left thigh? And I'd be like confused. I'm like, how did you know you had pain in his left thigh? Because the person did. And it was because there's a nerve that goes from apparently from one part of your spine down to your like thighs. And so just having that like amount of knowledge and just being able to quickly ask them a question and realize like, okay, this L5 or L whatever is like the reason why it's in pain, like that was awesome. One thing I really didn't like though was that I don't know if this is for all neurosurgery fields or it was just specifically this practice or whatever, I don't really know, but there was a lot of like it was like the same thing over and over again. Like obviously there was little differences because every patient is different, but it was always older patients because spinal degeneration happens as you grow older, right? So it was a lot of spine cases first of all, and while I like the spine, my interest is more in the brain. So it was a lot of spine cases, and it was always the same area of the spine, and it was always the same problem in the spine. So that means the solution was the same thing. And maybe it was just that specific day, or I don't really know, but for me it felt kind of repetitive. And then also, again, the same thing. This goes for like all fields of medicine, but like the patient interaction, while when the good was good, it was great, but when it was bad, it was really bad. Like sometimes there would be patients where like they wouldn't even listen to you. Like you would tell them like you cannot do this certain procedure on them, or you cannot fix the certain problem they have because it's too deep in the spine, or it's too, I don't even know, like there's some reason why they can't have what they want, and they will not listen. And obviously I understand, like if you're in pain, like I've gone through procedures before, like I understand, like if you're in pain, there's certain things like you just want to happen, but as a doctor, like having to sit there and like keep your calm while the person's like rolling their eyes at you and just like talk, like going on and on about how like they know better, that part was like extremely frustrating. And I'm not even the doctor, but like I was just standing there and I was like, what is going on? I don't know, I just loved the OR. Like I loved how like first of all, there's this guy nurse there, and he was the nicest person ever. Like he was so sweet. Like I was standing for a long time. That's another thing is I don't like, it's like how long you have to stand. Like I don't know if I just have really weak bones or something, but you have to stand for so long in the OR, and apparently some cases go on for 10 hours. 10. How am I supposed to stand for 10 hours? I stood for an hour or two and my back was hurting, my legs were cramping, and I was like literally about to pass out, and I wasn't even the one doing the surgery. I don't know if it's something you need practice, but it was just like, it was, yeah. So one of the guy nurses, he like saw me and he was like, he realized I was like getting cold or whatever, so he went and bought one of those like scrub coats for me and he put it on me, and I was like, that's the sweetest thing someone's ever done for me. And I was like, I just love how everybody there is there for each other. Like there's banter, there's, you know, if someone's doing something wrong, like the other person is just like telling them, hey, you did that wrong, let's go fix that. Like if they need some help, like they automatically know what the other person is doing. Another thing, it was so cool the way, I don't even know, like it was so cool the way they just knew what the other person needed. For example, there's like these first assistants. So this is the surgeon, the first assistant is going to be here, the second assistant is going to be here. And the way the first assistant just knew what the surgeon needed at all times. Like he didn't even need to ask, and maybe it was just practice, or it was just like some sort of like sixth sense telepathy, but she just knew the second he needed something, she already had it in her hand. Or before he even asked, you'd be like, hey, do you need this? Like it was just constant, like it was like just what I learned, I actually learned a lot about like what personality type makes a neurosurgeon. Because for me, I thought neurosurgeons were like just these like for me, because if you think of neurosurgery, you think of like stuck-up doctors who like think they know everything. Like I mean, you're a neurosurgeon, I would expect you to have like an ego, but like no, I mean, there was a couple of neurosurgeons I met. I mean, there's doctors I met like in the OR and then outside in the clinic. All of them were so like down to earth. They were, you know, they were human. Like I feel like being able to shadow them humanized them for me. Because for me, doctors are like God. Like I saw them and I was like, oh my God, these are just amazing people, and they're like so talented, and they're just like, but being able to like actually like follow their day made me realize they're just human. Like they crack jokes, they have a favorite food, they like the surgeon I shadowed hates spicy food. Like that something I was like it was like, oh, he doesn't like spicy food. One thing I learned that I also liked was that you get to use your like skill in languages. And y'all know I love languages, I love learning languages, and the surgeon I shadowed, he is ethnically Korean, and so he has a lot of Korean patients that I assume come to him because he can speak Korean and they feel more comfortable around him. And the fact that like a lot of the patient interactions were done in Korean, and I can understand a little bit of Korean, so I was like doing okay, but just being able to see how just they got more comfortable once they realized like he could speak Korean, and they just like communicated. They were smiling more even though they weren't getting very good news. Like they were just more comfortable, and I felt that was an amazing like thing to see. It was how the language can just immediately affect how that person receives you. I learned that there's an emotional toll, even if it's just like not even if you're doing a surgery, just like in clinic and just talking to the patient, there's an emotional toll that goes into it. So that's something I have to think about if I'm ready for that type of emotional like damage, I guess, that being a doctor will do to me, and if I will be able to cope with that. I really like diagnosing illnesses. I really like that process. Whatever field I go into, I want to be able to diagnose patients. Like, that's like my main thing, is I want to diagnose, I want to look at images, I want to look at their symptoms, and I want to be able to piece it together like a puzzle and diagnose them with something, or maybe tell them they're gonna be all right, like there's nothing wrong with them. I also like really like the surgery aspect of it. What I learned was that like it's very like specific. Like, it's not just like you cut it, you open it, you take it out, and you stitch it back up. Like, it's like first you have to go through the muscle and the fat, and you have to go through the ligaments, the tendons, the bones, and then you have to go through the outer layer, and you should be very careful. Just being able to see that, it was something I really want to do surgery now. Like, I just look at them like surgery seems like the thing to do. Like, I just love the process of being able to like actually go in and fix the problem than just telling the patient that they have a problem, you know? I mean, I saw neurosurgery as like this unreachable thing. Now that I've shadowed, I learned that it could be something I could do. Would I go into neurosurgery? The answer is yes, I would. I think it's an amazing field. The only thing I would do is maybe go into like pediatric neurosurgery, just because for me at least, I feel like I would, from what I saw, and this is obviously, it was only 2 days, so I didn't see a lot, but from what I did see, I realized that I want more like variety in cases, and I want more like cases that are like hard to do, that might like, with the skill set that I would have, I want to be able to like find new innovations. Like, if there's something that hasn't been done before, I want to be part of like finding a new way to do it. Pediatric neurosurgery might be more up my alley, so I'm going to shadow a pediatric neurosurgeon and see if that is more of what I want to do in my future career. However, the thing about going into pediatrics that scares the living shit out of me, especially, and OBGYNs, is that I don't know if I could handle losing a child, which is another reason why I want to go and shadow a pediatric neurosurgeon, because there will be times where like I will see sick kids, and I need to be able to know that I could handle it. So watch out for that video, because I'll talk a lot more in depth about like patient interaction in that video, and like how the emotional toll it takes, because I'm sure it's going to be really hard. I definitely would go into neurosurgery. My only thing would be like it's a very long residency, so I don't know if like I would be able to handle that much, which is why obviously I don't have to choose right now. But I'm gonna stick with my major, and I'm gonna see how my interest in neuroscience grows, because I really think I could do neurosurgery if I put my mind to it. So yeah, that's my first ever shadowing experience, which went way better than I expected, because I definitely thought I was gonna vomit in the OR, but I didn't. It was actually really cool, really interesting. I love to see the anatomy. I mean, I realized I love anatomy and physiology now, which is not something I thought I would like, but I loved all of it. I will see y'all in my next shadowing video, which I hope to have in a few months, so be on the lookout for that. It'll happen around maybe March. But yeah, I'm gonna be a doctor, guys, so. My outro, I still need to figure out what to do for my outro, but like, share, and subscribe. Leave a comment down below if there was anything you want to see, if there's a certain doctor, a specialty you'd like me to shadow, because I would love to hear. Maybe I don't know all the specialties in the world, so if there's like some obscure specialty that like is really interesting, let me know down in the comments below. Also let me know if there's any questions you have. I'll try to answer them the best I can. I do want to put like a little disclaimer saying that like this is just personally my experience, none of this is like has to be factually true. This is just a pure like opinion piece. This is not like a factual like information session or anything. If you want one of that, you should go to like a neurosurgeon's channel. I hope you all liked the video. If you did, hit the like button, and I hope to see you all in my next video. Bye guys.